those of you who know me, I'm Adrian McConnell. I'm the CEO of the CEO Research Trust. And I have to say, I'm really, really pleased to have Peter Smith, who's Director of Policy and Advocacy at NEA. Um, those of you who know NEA, they're the UK's principal fuel poverty charity. And they focus on advocacy and engagement, research and evidence gathering, providing practical help and advice to people, as well as awareness and education. And as a charity that supports work in a adjacent and related field, certainly very much the model that we look at when we think about how we structure our work and what we do. I mean, fuel poverty has been a huge issue that has increased and crept up the agenda over the last few years. But NEA have been at the centre of the conversation and have been absolutely instrumental in getting the government to do the things that they've done. And Peter's been with NEA since July 2010 and has been, pretty instrumental in making sure that the charity has been in the thick of things, influencing government, industry, the media, and other stakeholders, making sure they understand the causes and impacts of fuel poverty. And so NEA, next week is Fuel Poverty Awareness Day. That's the Wednesday, the 27th of November. I'm sure Peter will talk a bit about that. He also has a conference up in Liverpool on the 27th and 29th of January. And there are a couple of other initiatives that they're doing that I think Peter will probably touch on: Operation Warmth, and then the nation's biggest housewarming. So that's enough from me. I'm going to hand over to Peter now. Thanks, Peter, for joining us. The floor is yours.
Thanks very much, Adrian, for that really warm introduction. Big thanks to you also for inviting me to do this lecture. Really welcome working with the CEO Research Trust, and may I just say many thanks to Lauren and Kimberly for all the help and preparation that they've provided. I'm going to now enter into the moment of doom, or I should say, while I try and share my screen. So bear with me while I look slightly concerned. How's that looking, Adrian? If you wouldn't mind just telling me, or one of your colleagues, is that looking okay?
That looks great, Peter. Thank you.
Fantastic. Okay, well, thanks to Adrian's introduction. I don't really need to dwell on the self-promotion, but I will just touch a little bit more on National Energy Action. We've been around for about 40 years, trying to make sure that everybody can be warm, safe, and healthy in their home. And we work together with a range of practitioners to try and enable that. We've been fortunate enough to work with CORT and its predecessors on some positive research in this space, and I'll share a bit of detail on it in just a moment. But the focus, hopefully, for my remarks will be about what we can do going into the future as well. From my side, I've been at NEA since 2010, as was referenced. And I am responsible for the policy and research work at NEA and our wider communications work. That time, we've seen quite a lot of changes. We know that the energy crisis has prompted a huge surge in the interest and knowledge, sadly, of the direct experiences of fuel poverty, how those affect individual households. And in that time, our advocacy function has grown, and we've tried to enhance our focus with the media and other senior stakeholders in government and in industry to try and affect positive changes on behalf of the most vulnerable households. And prior to finish this biog, prior to NEA, I worked for a couple of years at a trade association, the Combined Heat and Power Association. So I'm fully aware of the need to make sure that both industry and government stakeholders work together to affect positive changes. So, onto the subject at hand. I thought it'd be useful to set out some brief introduction to fuel poverty. I'm sure all of you will be aware of fuel poverty and its associated issues. But just as a bit of a recap, before we can think about the progress that we've seen to tackle fuel poverty and the links between carbon monoxide exposure, it's absolutely essential to have a look at both of those issues in a relatively discrete way. So, in terms of fuel poverty, the first thing to say is that it's overly dominated by people thinking or worrying about the definition. And in the last two or three, sorry, in the last decade, we've had two or three definitions from the UK government about how to define fuel poverty. I'll touch on the current one in England, and the rest of, and the other definition that's used more commonly across the rest of the UK. So the low income, low energy efficiency indicator is the most recent version of the government's measurement of fuel poverty. And what it really means is whether or not you're living in a inefficient home, which is judged to be band D or worse, using an energy performance certificate, and at the same time as living in that really energy hungry home, you are living below or off the poverty line, which at the moment, on average, and I say this very loosely, given that it's equivalized across households depending on how many people in your household. It's about that means that you've got an average of around 14,000 odd pounds a year, which is a very, very low income. But at the same time, you're obviously struggling with having to deal with some of the highest energy costs at a time where energy has been incredibly expensive. Indeed, it continues to be about £500 a year more than it was prior to the energy crisis. Other people will be perhaps more familiar with the 10% definition of fuel poverty. Households that need to pay more than 10% of their total household income to maintain a satisfactory heating regime are regarded as in fuel poverty. And that's the definition that the charity uses for campaigning purposes more than anything, to sort of track where we are at a UK-wide level. And unlike the previous low income, low energy efficiency level, that really does show up what the impact of higher energy bills are. And so it's been right to use that metric to track the extent of fuel poverty during this recent energy crisis. We know that on the basis of that definition, fuel poverty grown from about 4 million households at the start of the crisis in 1920, and it got up to 7.2 million at one stage, and it would have been 8 million households across the UK that were living in fuel poverty had it not been for the government's interventions. However, we are very concerned, as I'll touch on later on in my remarks, that following the removal of that support and the winter fuel payment, there is actually less support available this winter, despite households continuing to endure incredibly high energy prices. And based on that metric, around 6 million households are going to be living in fuel poverty this winter. And that takes into account the likely slight increase in bills that was likely to be announced at the end of this week by the regulator Ofgem, the price cap period that we'll all be paying pretty much from January until the end of winter. We know that beyond definitions and numbers in fuel poverty, that the most concerning aspect of it is the huge impact that it has on people's health and well-being. We know that really, if you're in fuel poverty, you have two choices. You've got the opportunity to heat your home, but to run into very significant levels of fuel debt. And fuel debt, we know, is called highs, with about £3.7 billion worth of money owed to energy suppliers. And the other option you have is to not heat your home at all, or moderate heating within one room, or try and ration your use of showers or baths, which can, as well as property damage, lead to incredibly negative impacts on physical and mental health. That's I'll just come on and talk to you about. In terms of the physical health impacts, they're very well known now. But they largely relate to respiratory and circulatory challenges. We know that that a cold home has a really, really problematic impact for those people that are struggling with respiratory or circulatory problems. And it can lead to, in some instances, to a range of other issues. Today, we're going to really focus on where those health impacts overlap and create the risk of around carbon monoxide poisoning, potential electric shocks and burns from unsafe appliances, and the prevalence of lower level headaches and illnesses and slow recovery rates. All of those health, direct health impacts, physical health impacts, have a huge toll on the individuals, but they obviously have a societal cost. And one of the concerns that we have without adequate action on fuel poverty is that the opportunity to prevent these issues by taking preventative action are mitigated, and in their place, they're replaced with costs to our already health-stretched health services who are stretched to the very limit over the course of winter. Mental health issues to do with fuel poverty just as prominent and in some ways just as concerning. Stress and anxiety and full-blown depression have sadly been on the rise since the cost of living crisis began, and energy is a huge component within that. We know that parents who live in fuel poverty and struggle to bring up a child and in a warm living environment are much more likely to develop depression, which is obviously very difficult for them, places huge strain on those children who have to live with that parent, but also the wider impact again on society. People that have got depression, either the cost of pharmaceutical treatment or the cost on mental health services, which are again at breaking point. We know those impacts aren't just limited to elderly households or households that are adults. Adolescents are also facing very, very difficult negative health impacts, particularly mental health impacts associated with growing up in a cold home. Both stigma and social isolation, and feelings of loneliness when they can't invite people round, and there is a huge impact on educational attainment if a family is only able to heat one room, and that child has to study there while everybody's watching TV or talking loudly or cooking, etc. And we know that that means that teenagers are almost twice as likely to have mental health impacts, and in some very significant and severe cases are likely to attempt suicide. So it is a very, very difficult picture. And we know that many of these drivers for fuel poverty are very acute at the moment. And obviously, at the moment, the cold outside temperature is only heightening our concern for people. But that concern is really leading to the adoption of what we call unsafe coping strategies. They're where the household actually isn't coping at all, but they're doing things that are negative either to their own physical or mental health, or are potentially imperiling nearby neighbours or people living near. And also putting wider public services like our fire and rescue services under greater strain. I won't go through all of these, but just to pick out a few which are very topical for this presentation. We're seeing a lot of people cooking on alternative sources of heating, using alternative sources of for cooking. Things like we've come across people barbecuing in sinks. We've seen people using unsafe, unserviced cooking appliances and heating appliances which emit CO. We've seen people cutting back on lighting and using candles instead, again with potential for fire risk, and other unsafe practices which really mean that people are putting themselves and their neighbours at much more risk. Just turning to the key subject at hand, carbon monoxide and fuel poor homes. Although we know that carbon monoxide is a very significant danger in all homes, we know from research, which I'll come on and speak about, that those in fuel poverty are at greater risk. The main reasons for that are I've touched on loosely already, but they're unable to afford gas safety checks, and I'll come back and talk to you a little bit more about that concern in a moment. They're likely to live in less efficient homes, which again are likely to contain older, less efficient, probably much more unsafe heating appliances. They're more likely also to be suffering from ill health, and particularly those ill health effects which are very badly affected by the cold, but also prohibit the identification of CO. Things like depression and other mental health impacts and other physical health impacts can lead to headaches. And I'll talk to you about Michael's story in just a moment. And that's very hard to define. And then, as we talked about, the adoption of these unsafe coping strategies is likely to be resulting in very carbon monoxide associated behaviours, which put people at risk. Sadly, and this is true of fuel poverty as well as carbon monoxide, we know that the most vulnerable people in our society are those that are at greatest risk. So those are young children, and pregnant people that are pregnant and are waiting to give birth, elderly people that spend a lot more time at home, and then people with oxygen-related diseases that often struggle with some of the symptoms associated with carbon monoxide poisoning. This means that really all of us in this room have a joint responsibility to protect the most vulnerable people in our society, and we would welcome working with you much more closely with you to protect these core groups of households. I'll also come on and mention some of the initiatives later that NEA are running that look to reach out beyond these core groups of vulnerable households and try and make sure that harder to reach groups are also benefiting from relevant services. So I mentioned some of our research. Back in 2017, my colleague Juliette Burrows, who sadly is no longer at NEA, she's in Victoria in Australia, running their affordability and energy efficiency programs. But she and NEA undertook a joint piece of research looking at the carbon monoxide risk in households and how that then correlated with fuel poverty. In order to do that, we developed some primary research and some monitoring across almost 350 households, targeting those on the lowest incomes with a range of vulnerabilities. And we did to ascertain real CO levels from individual members of the public, talk to them about what their heating practices were and their awareness of support. From that, we identified actually a staggering amount of those households were suffering from low levels of carbon monoxide poisoning, some beyond the elevated levels of 10 parts per million, which is obviously the risk threshold for carbon monoxide. Often that was as a result of those households having such low incomes that they weren't able to regularly service either heating or cooking appliances, and those were acting as a real danger in their homes. And we also know that there was low or limited knowledge around the support that was available for households. Shockingly, only about 1 or 2% of the households that we interviewed were on the priority services register, despite it being clearly eligible. And in some instances, the services provided by the PSR could have been absolutely life-changing. We also found that there was low levels of awareness around the associated energy efficiency programs that were around at that time. But the main conclusion to draw from that research was that there is a great overlap between those households that are at greatest risk of fuel poverty and those that are at risk of CO in their homes. And although there was no causal link found, and it's important to be clear that it's not a causal relationship, they are heavily correlated, and these two risk groups do heavily overlap, particularly where there's a high prevalence of someone operating an unsafe or older heating system or cooker. So I tried to, when Adrian suggested the lecture, try to bring a slightly upbeat tone to my remarks, which isn't often common for me, but I have tried to. I will try and provide some uplifting side to my remarks by looking at the progress there's been. And there has been progress, and it's right to reflect on that progress and in some ways celebrate it. We have seen that there is now a significant funding through the vulnerable consumers carbon monoxide allowances within the price control. Now, significant funding available for projects which look to tackle the overlap between CO risk and fuel poverty. There's even more resources through the repurposing of the previous fuel poverty gas network extension scheme to those ends as well. And although the latter is only temporary, we're hoping that Rio3 will mean a continued focus on dedicated focus and significant resources at the current level to make sure that there is ongoing support in this area where it can tackle both fuel poverty and carbon monoxide at the same time. We believe that also that there is greater awareness and advice out there, greater awareness of the risks around CO, but also the support that's available and advice to households in terms of how you tackle these identify and tackle these issues. We've been most pleased by how receptive the gas networks have been to train their in-house staff to identify vulnerability and potential risks around CO, as well as other parties now doing the same thing to make sure that any interaction with vulnerable households within their home does put up front of their considerations the risks around potential for carbon monoxide leaks, particularly from those sources that I've mentioned earlier. We've also really welcomed the collaborative work, which is still ongoing in some instances, to work directly with the gas networks to put in place a much better and a much more robust set of protocols for supporting a household where the heating source or the cooker needs to be condemned as part of their gas servicing work or gas safety work. Previously, although there were some elements of good practice within the framework, often households were left to fend for themselves once that boiler was condemned. Now, the majority of GDNs, if not all of the GDNs, have a bespoke pathway for those households that they do need to condemn their gas appliances, for there to be some offer of repair or a replacement for those households that really can't afford it. We work directly with the likes of Cadent, for example, under their repair and replacement service to deliver that support. And we also welcome the other GDNs who are working with other partners to make that a reality. We've also seen the introduction of better ventilation requirements within retrofit schemes, notably PAS 2030, PAS 2035, the requirement for there to be significant ventilation in the property when energy efficiency measures are installed reduces the risks around CO. And we've also seen tougher regulations on landlords, first the annual gas safety check, the requirement for gas safety alarms where there's solid fuels being used, and also the minimum energy efficiency standards, which are looking to remove the rental of the least efficient homes, will have all had a positive impact on reducing the risk around carbon monoxide poisoning, and are to be celebrated and welcomed. Crucially, where they're enforced, and I'll come on and talk a little bit more about that in just a moment. And then finally, we are seeing more joined up services across particularly statutory bodies. We welcome the good work of various fire services across the country who are looking to prioritise CO or awareness as part of their outreach, particularly when it comes to installing fire alarms. There is great practice. I was fortunate enough to meet Brinley from Midlands Fire and Rescue, who are doing fantastic work in this space, and other fire and safety services are also following suit. We saw the excellent trial with Sierra and Cadent around a range of partners working together to try and work behind the scenes to make sure that there's best handovers between the different agencies and what support that they can provide to households that are at risk of CO, so they get comprehensive advice about all the support that's available for those households to stay warm and safe in their homes. So there has been significant progress, and we should welcome that endeavour. And I know that CORT and other people on this call will have been at the heart of that, and we thank you for all the work that you've done. In terms of ongoing challenges, there are a number I've mentioned already, but the continued high price of energy is continuing to lead to unsafe coping strategies, and they'll be very evident on cold days like this. People starting up fires for the first time in their house, burning things which aren't supposed to be burnt, running appliances which haven't been run all year or been safety checked. Sadly, with less disposable income, we are also seeing a trend of people sacrificing carrying out gas safety servicing and gas safety certificates in their home. And this is one area of potential joint coordination, collaboration with CORT, we hope, into the future. We hope that we can show just how important it is for households to prioritise that expenditure to make sure that their home is safe and healthy. We're also seeing slow progress on energy efficiency, particularly towards our statutory fuel poverty target in England. We are very concerned that we're hugely behind in terms of trying to make sure that we don't miss yet another statutory fuel poverty target, having missed the 2016 target. And if we just left things as they were, and based on current programs, then we know about 3 million households would still be in fuel poverty by 2030, which is the date where, on a statutory or legal basis, we should have made sure that as many homes as reasonably practicable been in a Band C property or above. And then we are concerned as well about the lack of access to repairs and replacements of fossil fuel heating systems within national grant schemes. Talking to Adrian just before this presentation about the likelihood that there are a number of what we call zombie boilers, where they've been installed by a previous grant scheme. The warranties have long since perished. The occupants haven't had the means to be able to provide regular gas servicing or gas safety certificates, and yet these boilers are coming to the end of their useful life. Could be presenting a very significant risk to people's health, either their occupants or their nearby neighbours. So we are really keen on seeing a really tight focus on that, and potentially, particularly where there's medical health issues, opening up further access to households to have repairs and replacements of those fossil fuel heating systems where a low carbon alternative such as a heat pump might not be viable. And then finally, I mentioned it on the previous slide, but the regulations that have been put in place are only as good as the enforcement. Following the huge challenges that local authorities have been under over a decade or more, it's very likely that much of the enforcement capacity that there should be within those local authorities to police housing standards is really waning. And given the government's commitments to extend those requirements, not just in the private rented sector, but also in the social housing sector, we're hoping that local authorities will be given the means and enhanced capacity to be able to enforce those regulatory requirements, because without that, they are just as valuable as the paper that they're written on. So just turning a little bit more to the challenge this winter, we do know it's going to be acute. Prices went up 10% in October, and they're likely to go up by a couple more percent from January. That's leading to physical and mental health impacts that I've mentioned, but also the debt is now at record levels, and it's up 2.6 billion on a year ago. That's just completely unsustainable for the sector, and will prohibit those industry partners going on and delivering important aspirations like trying to make sure that there's a net zero energy system or electricity system by the end of this decade. We also know that, as I've mentioned, support has been reduced. So it is a very concerning time. And where we do express this just as a concern about fuel poverty, we also, because of what I've explained, highlight that this is a really big risk in terms of increasing the prominence or the risk around CO. So it's only right to say, well, what are you doing about it? Don't just talk about what other people can do. What are you doing about it? We are doing quite a bit as a charity. National Energy Action are first and foremost charity which is campaigning and advocating for change. I mentioned some of the changes we'd like to see with crisis heating and within RIIO-3 to make sure that the current ring-fence VCMA is maintained or even enhanced. We'd like to see some further funding for energy efficiency following the modest down payment that was in the budget. We'd like to see the full manifesto commitment for that. And we're trying to make sure that the regulations in the private rented sector and social housing sector do take account of the needs of those people that are at risk of CO. We're also providing a lot of one-to-one support. Our energy advice team, haven't really stopped since the onset of the energy crisis and have been working very, very hard over a number of years now. But we have got a couple of programs which are particularly targeted at those at-risk groups around CO. So Warm Welcome is our program to support people that are pregnant and new parents. We've mentioned already that babies and pregnant people are much more at risk around CO. This tries to give them all the advice and support that they need to reduce their risk of being in fuel poverty and suffering from carbon monoxide. Empowered Energy is another program that makes me incredibly proud to work at NEA. This is for refugees and asylum seekers, people that haven't had the benefit of knowing where they can get support with energy-related issues, but also sometimes have cooking practices or other practices that they're familiar with, which can have an implication in terms of CO risk. So that program is trying to support them to understand where the support is and how some of those sort of energy practices need to be adapted given the risks that they present around CO and also fires as well. We are providing, as I've said, partnering with the GDNs to provide crisis repairs and replacements for some heating, and we do that on quite an exceptional basis. We have to ration the support that we can provide in that regard, but there is some support that we provide for that. Our Warm Homes Healthy Futures initiative is a vast programme alongside, again, the GDNs to try and work with the health sector to provide them with advice and in some instances direct support for households that are experiencing the risk around fuel poverty. But carbon monoxide awareness is a huge element of that programme, and we're delivering, we hope to deliver support to around 30,000 households as a result of that initiative over its lifetime. We're also carrying out schools and community engagement work and working with the community more generally to raise awareness of the risk around CO and how that intersects with vulnerable groups. And then finally, we're continuing to work on research, which is looking to identify what are the key gaps that industry or academia or the third sector can help solve around these two agendas. And I'll touch on some of those gaps in just a moment. Before I do, I just want to briefly reference Michael's story. You'll see the quote there. He was getting headaches, and he thought that was due to the stress that he was enduring because he was unemployed, living on a low income. But in fact, Michael was suffering from pretty acute, as it turns out, carbon monoxide poisoning, despite, in his instance, living in social housing. The social housing in question was relatively energy efficient, but it had a fleet of older gas cookers, and they weren't working. The carbon monoxide alarms that were put in were also faulty and going wrong, and been sort of tripping and going off regardless of whether or not that there were any leaks. So the households themselves or tenants themselves weren't taking too much notice of them. As a result, Michael and a number of his nearby neighbours were being put at acute risk because there was actually carbon monoxide in the property. It was only that off the cuff remark by somebody, one of his nearby neighbours, that prompted him to the fact that this could have actually been carbon monoxide. And then when he contacted the social housing provider, they did undertake a full assessment where the carbon monoxide could be coming from, or whether or not there was carbon monoxide and where it could be coming from, and ascertained that it was his hugely unsafe cooker. They condemned the cooker, but didn't immediately replace it, so he got in touch with NEA to see whether or not there were sources of funding that would enable him to buy a microwave. We found those sources of funding. We also were able to provide him with income maximisation services and other support, which means that he's a little less stressed out, but particularly no longer immediate threat of carbon monoxide poisoning. Michael's story, as you'll know from your own practical work, if you work in this field directly, is by no means unique. And in some ways, we were very fortunate to find Michael before it was too late. But we do know for many households, it can be too late. We've all got to be proactive, including National Energy Action, in terms of identifying where those households might present and addressing the risks that they're very, very much in the clutches of. So, question: what more could we all do? Well, I tried to think ahead of this presentation just a few things that we could be doing. So, more awareness raising, I think, is a given. We do a lot to raise awareness of fuel poverty or carbon monoxide generally as topics. Probably not as much as we could do around the overlaps between those areas. I'm certainly going to challenge our comms team and others to work more closely with CORT and other bodies in this space to try and make sure that there is a louder noise about that overlap. I think that it's fair to say that although there is good practice within various statutory bodies like health and fire services, it is important that we strengthen that work and that we really embed it. and make sure that it isn't good practice, sort of outlier, that it's reflected in mainstream ways of working for all of our statutory bodies. There's a real opportunity, but also a concern at the point of discharging patients, that as well as potentially discharging them back into a cold home, we're discharging them into a CO environment. And again, focusing on that overlap could be really valuable. I think trying to get on the front foot, and instead of the reactive work that I've sort of described historically, whether or not we could start preempting where some of these heating systems and heating appliances are likely to be failing. Is there a way that we can go through the SEDBUC register of boilers and identify that zombie fleet of boilers that may not have been serviced for a long time, and where the household wouldn't have been able to afford a good safety check? And whether we use to join that information up with things like the Priority Services Register, smart data, or wider support to try and make sure that there's that comprehensive journey for those households that are most at risk. One of the areas that I think we could collectively do, but particularly work with CORT, welcome working with CORT on this, is about looking at the avoided costs the health services are taking action in this space. We know that the cost of a emergency hospital admission is really expensive. It's about £4,000, £5,000, £6,000 a day, depending on where you are in the country. That cost could entirely be avoided if people weren't experiencing the risk of either a cold home or a CO risk. And so trying to understand those avoided costs in more detail could potentially be really game-changing. Talking of game-changing, can't mention the word game-changing at the moment without talking about the potential role for AI. Friend or foe, it's right to consider what role AI has, whether or not it could be doing some of the harder work for us rather than replacing either my or Adrian's job. But it would be really important to see what the opportunities are within AI, but again, predicting where households may be at greatest risk. So, final remarks from me. I just want to say that I hope I've demonstrated that fuel poverty and CO poisoning are not just linked, but crucially, they both have a common theme, which is they are both entirely preventable. That's what motivates me to get up and do my day job, is the sense that we could be doing more about this if we tried. Sadly, some people work for a charity where, you know, a particular health condition, there is no cure as yet. But we've got the fortune of knowing what the solutions are and how to address this issue. Really, the main challenge is the creating the demand and biggest possible, turning up the volume as much as possible to ensure that our policymakers provide those policies, and that we will work within those environment, and to make sure that we're tackling the impact of higher energy prices, the inefficiency of people's homes, and we're maximising people's incomes. We've also got to put that pressure on locally to make sure that they're enforcing current regulations and safeguards, which, again, I'll stress, are only as valuable as the paper that they're written on if they're not adequately enforced. One very near-term thing that we're hoping that you could support us on, if you've been moved or would like to continue to work on the overlap of these two agendas, is our Fuel Poverty Awareness Day. Adrian was kind enough to mention it in the introduction, but Fuel Poverty Awareness Day is on the 27th of November, and we need your voice now more than ever. So please, can we work together and work in lockstep to shout really loudly about the need for change, for the benefit of those people living in cold homes, but also those people at great risk around carbon monoxide. In the final slide is just a bit of a recap on what we've spoken about. I hope I've done that all justice. And Adrian, I'm sorry, it's probably taken longer than planned, but I hope we still got lots of time for questions. Thank you very much.
Thank you, Peter. That was a really, really great presentation. And it's, you know, it's really good to, you know, hear the positive things that have gone on. I think it's easy, you know, when you deal with issues like ours, to sort of, you know, dwell on the bad things and the fact that there's still such a long way to go. But, you know, progress has been made, and it was nice to hear that the contribution the GDNs are making, you know, they're a very big player in our world of CO, and it appears that they're very involved and proactive in your world. And it was interesting because we held a training session up at Liverpool John Moores University. I think it was the beginning of the month, and it was all about the lived experience of people who have been exposed to CO and those issues around that make it more likely that they are, going to find themselves in that situation, sort of social exclusion, financial exclusion, and the overlap is immense, really. If there's a Venn diagram, that section is huge. But you talked in your presentation about the 6 million homes in fuel poverty, and that there's been less support this winter. Do you have any hopes that the government will introduce some sort of emergency support for those people? Because you saw that your slide with the challenges. Some of those numbers are quite staggering, really. Do you have any sense of any help that might be forthcoming?
Well, sadly, just in terms of national government support, probably not until the spending review, which is going to be sort of March next year. The budget was the number one opportunity for the government to step up and really help this winter, and they haven't sadly done that in terms of tackling unaffordable energy bills. There will be some support announced fairly imminently, we think, from energy suppliers on a voluntary basis about what additional support that they're going to provide to customers. Which will be valuable, but only to the extent that people will be able to access that support from their energy supplier, and it might vary from supplier to supplier, and they'll need to be aware of that support and then try and redeem it. The only other sort of light on the horizon that we can see is the possible announcement of some very positive announcement on reducing levels of fuel debt, which we hope will have an impact. But it is unlikely to have an impact until sort of July, sort of summerish next year. So not a lot of short-term hope, sadly.
Okay. But in the longer term, I mean, what are your hopes for the government and their warm homes plan, or perhaps, steps that they're going to take to actually improve energy efficiency? Because one of your slides said about the leaky homes and the fact that we have this aging housing stock in the UK. And obviously it's something that we think about a lot. And really, fuel poverty and CO, it's a really significant housing issue. And, we've got to, if we're going to meet those the energy efficiency targets, fuel poverty targets, that's something that we've got to think about. Do you have any sense that the government are going to be acting quickly to sort it out in the long term?
Sure. Well, we've already welcomed some of the announcements that they've made. They've, as part of the Warm Homes Plan, they've said that they will extend the minimum energy efficiency standards in the private rented sector and the social housing sector, and we're waiting for consultations that follow up on that. But particularly in the private rented sector, we know that commitment was first made in 2017, and it still hasn't happened. So we're hoping that we'll get on with that as soon as possible. But that is a welcome step. We've also seen a down payment of some of the manifesto commitment to spend an additional £6 billion on top of the previous government spending commitments on energy efficiency over the course of this Parliament. I think it was about £3.2 billion that was announced at the budget in advance of the rest of the money coming in the spending review. Will really kickstart some important programs, particularly local authority delivery programs, and we're hoping some additional support for households that aren't particularly well served by their local authority, may not be able to get support through their energy provider. But a bit like the previous Warm Front programme, they might be able to self-refer themselves to a scheme and get the measures that they desperately need, including crisis heating repairs and replacements for fossil fuel heating systems. So we are hopeful that we'll see a bit more flesh on the bone on that overarching plan in the new year. But we've seen some, promising starts, and we hope that progress will be maintained.
Yeah. Okay. Thank you. I'm quite conscious that there are a couple of questions in the chat here, and Rebecca Close from the UK health security agencies put her hand up. But this is the luxury of being the chair of these things. You hold the conch and you get to ask your questions first. So I'm going to indulge myself, if that's okay, and ask you one more question. If CORT was to fund another project in this area, because obviously we worked with you on that project that Juliet undertook, a few years ago, what would be the one project that we could perhaps support or fund, or what area could we fund a research project that had the greatest impact on what you do and contribute to how you're improving the situation in terms of fuel poverty and CO?
It's hard to pick out one, and I put in a bit of a smorgasbord in my presentation of various ideas, including investigating the sort of avoided cost, which I do think is really required in order to motivate, particularly health service to work more in this space. If we can get CCGs interested in this by talking about the bottom line, then that would be excellent. But I think the near term, the one that I'd pick out the most is probably the near term opportunity to really understand the consequence of the assumed behaviours that we're seeing at the moment around households not prioritising getting free gas safety checks, or gas safety checks undertaken out of their own pockets. The opportunity to benefit from a free gas safety check hasn't really ever taken off or been very well promoted by some industry partners, not necessarily GDNs, but other partners.
Yeah,
So getting behind the skin on that, understanding from households' perspective why they haven't been able to prioritise getting a gas safety check carried out,
yeah,
and how that's being traded out amongst the other sort of household expenditure that they need to prioritise. I
yeah,
think that would be a great piece of work to do jointly, Adrian, and
yeah,
yeah, we
yeah.
have opportunity to do that.
Yeah, well, we've talked a lot over the years about having a mechanism so that GPs, if they have someone present themselves at a GP surgery, could prescribe a safety check. Maybe that's something that could be pursued. And we do a lot of work with the projects that interact with the NHS, and through that we can access NIHR, National Institute of Health Research funding. So perhaps that's something that we can talk
Very good.
about. I know Helen's in the thick of things at the moment, but perhaps when I come up to Liverpool in January, I'll try and collar her for a coffee and we can talk about that.
Fantastic.
No, thank you. Okay, I'm going to read out the questions that are in the chat here in the name of time, to save time. And then Rebecca, what I'll do is you've raised your hand. I'll bring you in once we've gone through these questions, if that's okay. So the first question is from Dr. Julie Connolly up at Liverpool John Moores University. She says, have you come across any particular difficulties with working with people in deprived circumstances? And is there anything that you would say is especially frustrating?
I think it sounds like a very niche one, but it is significant. We've struggled a lot with monitoring, and the extent to which you can rely on either a household's broadband or a host broadband provider or a regular supply of electricity into the property to capture regular monitoring data.
Okay.
We did a lot of technical evaluations of projects and pieces of kit, which have resulted in very impartial data collection because of those challenges.
Okay.
And so that is a real frustration and something that you don't really necessarily think about at the beginning of a program.
Hmm. Okay. I mean, that might be something we could pick up and talk to on here. There are companies like ACO who have their home link system, which is in a lot of social housing and things where they tens of thousands, if not more, data points. Yeah, no, thank you. Okay, I think the next question is from Izzy Myers, who has been sort of lead in the world of CO for a long time. Is one of our experts, and she's a consultant. She asks, I am keen to bring to the table the consideration of an upgrade to the PSR definitions around vulnerability for fuel poverty and CO to better support current household situations, noting that the last update in 2022 was to do with how suppliers identify vulnerability rather than the actual definition of vulnerability itself. Is this something that NEA perhaps sees as a need, or are there other ways that we might be able to help those who are not managing, but are just outside the current limits that were set for vulnerability, particularly as this is an at-risk group that seems to be growing? Could have done with some
Yeah.
comments on that.
Well, I, I, first of all, I completely echo your remarks as well and her contribution. I hope I touched enough on the SEA partnership previously and the great work that that's led to. I would say in response to the question, the Ofgem are currently consulting on a updated consumer vulnerability strategy. So bringing into focus the points that she raises directly with Ofgem would be opportune time. However, the Ofgem definition of vulnerability is actually quite wide, and it doesn't necessarily prescribe or prohibit the inclusion of the groups that she mentioned. So I'm happy to speak with her afterwards about what the opportunities might be there.
Super, thank you. The next question is from Sam Malpas. In terms of building awareness, does NEA advertise the CO symptoms and the link to CO in pharmacies? His thought is that many who are unaware may attempt to treat their symptoms by purchasing medicines to get rid of the symptoms. So that's a great idea, really. Yeah.
100%. It's a great idea. We tried to do a little bit with pharmacies around fuel poverty prevention. We could be doing much more around the links with CO as well. So yeah, great suggestion.
Super. Okay, we've got one more question from Izzy, and then I'm going to bring Rebecca into the room if that's okay. Izzy asks, in considering nutrition around fuel poverty, we know that fast food outlets are clustered around areas of poverty. Some time ago, an HPA, PHE, now UK HSA study showed that the increase in the use of fast food outlets was because people didn't have money or time to buy food, plates, cutlery, buy a table, pay for heating and water to wash up or cook food. Portions were also large, so leftovers could be used for school lunchboxes. We know that poor nutrition goes hand in hand with fuel poverty. Is there a project where we can also tackle this aspect?
Yeah, well, it has a little bit. We've worked with the Food Foundation to put together a briefing, I think 2 years ago now, about what the links are between food insecurity and fuel poverty, particularly in young people. It'd be welcome to sort of update that briefing document. If I can, I'll try and stick the link to that document in the chat. But it was no way comprehensive. And there's much more that could be done in that space, particularly when it comes to the sort of educational side and the awareness raising of individual members of the public.
Super, thank you. Right, I'm going to invite Becky Close to join us so that she can ask her question. This is a test of my technical abilities to get it to work. There we go. Happy days. Hi, Becky.
Oh, hi there. Hi there.
Hi.
Thanks very much. Sorry, you probably don't need to see me because I'm currently sat freezing cold. Talking of my heating system over here has broken. So anyway, he's looking a bit wrapped up. No, just great. Thank you so much for the presentation. Really, really interesting. And I just kind of totally agree with everything you're saying there, really, and echo your thoughts and messages. I work for a UK Health Security Agency, and we've done quite a lot of similar sort of research, actually. So it was interesting to hear those kind of crossovers and messages. So I'm really keen to link up with you and hopefully kind of take some joint messages forward and some work. Maybe there's some potential work that we can do together. Be great to sort of discuss your different sources of data, and we've done a lot around monitoring as well, and I like kind of Adrian's thoughts on using these new sort of smart monitors. So just really keen to link up and be able to kind of take things forward. So thank you.
Super, thanks, Becky. I hope you get your boiler sorted soon.
Thanks.
If there's anyone on here who can help, then do get in touch with me, please. No, thank you for that, and I think perhaps that's something that we can take away as an action to, facilitate some sort of meeting so we can see whether there's some work that we could all do together. I'm just looking in the chat. Does anybody else have any final comments or remarks? Yeah, I mean, I just think it's such an important subject, and hopefully we'll see some movement with the government, as we move into winter, because something's got to be done. Those numbers are are quite obscene, really, aren't they? So we don't appear to have any more questions from anyone. Before I close out the meeting, I don't know, Peter, whether you've any final comments. I think what we'll do is when we send out the link to this to attendees, we'll include in the email a link to the information around the Fuel Poverty Awareness Day and how people can get involved in that. You know, I don't get anyone who's on the call who, you know, has a way of sharing that information and promoting that day. I think it'd be great if you could do so or share it with the relevant people in your organisation. So yeah, Peter, do you have any final thoughts?
Well, again, a big thank you, Adrian, to yourself, but also CO Research Trust more generally. I've really welcomed the opportunity to take a bit of a step back, and particularly to review the progress and what remaining opportunities there are to better tackle the overlap between these two agendas.
Yeah,
I've really encouraged by some of the questions and remarks, particularly the opportunity to potentially work with Becky and UXO a little bit more closely into the future, but a range of other contributions which have sparked other thoughts. I think slightly strange place to end it, but I think just sort of referencing what you'd said about we hope the government would act. I think we've got to do as much as we can, irrespective of what the government do. I think thankfully this government are receptive to tackling fuel poverty. That's been the case when we've engaged Number 10 recently and other special advisors. They are really keen on tackling this overlap, but as ever, it's what we can do in amongst ourselves, which will make the difference in the shortest possible time. So yeah, thanks again, and yeah, I've really welcomed and benefited from doing it. So thank you.
yeah, no, thank you, Peter. And yeah, what we'll do is we'll be in touch, and perhaps we can, you know, lead on from this event, and hopefully something will emerge that will be positive. And yeah, we'll you know, there's a group of researchers who are working on related issues. For example, Julie, who asked the question, so I'll make sure she's a part of the conversation too. So just a few final comments from me. We have our next lecture on the 15th of January, and it'll be something slightly different for us next time. Its focuses on the CO research that's taking place in sub-Saharan Africa. There's a group of researchers working in different countries that are working on different projects. We've been talking to them as part of the development of the CO Research Network, which we're developing in conjunction with Sheffield Hallam University. So that'll be a really interesting topic, something slightly different. So I hope that you can join us there, and the sign up page will go live pretty shortly, hopefully in the next week or two. Our current grants call is live. The deadline for submissions is 4th of December, which I think is a Wednesday. I should know because it's my wife's birthday. And if in the meantime you want to come and talk to us about perhaps applying for funding, please do so. Our grant leads, Gerarda Kendrick, and all the details are on our website. Finally, next year is our 20th anniversary. We've got lots and lots of events planned around that. Sort of looking back at what we've done, and then looking at the future and our new strategic aims and how we're going to engage. And just finally, just sort of circle back to what Peter was talking about, you know, how we kind of join up our approach across all the stakeholders in the CO world. If you want to be a part of that, please do so. And the best way to keep in touch with us is to sign up to our newsletter, which I think the sign up's on the website. But if not, again, when we send our email out, we'll include a link. So all it remains for me is to say thank you to Peter for his presentation and taking the time today. And we'll be in touch, because let's take this forward. And thank you to everybody who has attended and has listened in. I hope you found it as interesting as I have. Have a great afternoon, everybody. Thank you.